Alright, this is the knee, phase 1. First exercise is K10. This is the hamstring stretch. We just want to teach patients to kind of sit on the edge of the table. If the right leg's the one we're stretching, have it straight, toes pointed towards us. Have the patient sit up nice and tall. You can kind of do it with the hands on the hips is a good one. So you're going to sit up nice and tall, just going to bend up the hips, keeping the back straight. You can have them look forward. A lot of times you'll see them look down and the back will kind of bend there. So you just want to lean forward, start with 20 seconds, work your way to 30 seconds. You have them alternate back and forth. Usually just start with 3 on each side for 20 to 30 seconds. So that's K20, or K10, sorry. The next exercise is K11. This is the quad stretch. Your quad muscles right through here. We can stand for this one. You can kind of note the patient to kind of lift, if they can. Grab the back of their leg. Try to keep the leg in line with the body. Often you'll see their leg come out to the side. Try to touch their heel to their bottom. So it should look something like that. Have them stay up nice and tall. They should feel a stretch in the front thigh there. 20-30 seconds. Another variation of the quad stretch. Kind of lay on their stomach. Wrap a strap around their ankle or the shoe. Kind of have the handle in their hand right here. And you're just going to pull this way. Have them hold that. So they should feel it right through here. That's the quad stretch. The next stretch, I'm going to head over to this wall over here. This is the K12 calf and soleus stretch. One way, you can just have them put the arch of their foot up in the wall or any kind of object you have in your office there. Keep the leg straight. You're just going to lean forward into the wall. The other one, you can have the knee slightly bent. Same idea. And then the other version would be like the runner stretch. This would be the affected leg, so the heel stays on the ground, the toes are pointed straight. And you're just going to lean forward, front knee will bend. Hold that stretch, should feel that back in here. And that's K12. Next stretch, I'll head back to the table. This will be K13, terminal knee extension. This is for someone who is lacking knee extension, full range of motion. So you would set a towel roll, a tiny bolster down here by the back of their heel. This way you see some space underneath the knee. Often the knee will be slightly bent. They'll often already feel a stretch. If not, you can add weights on top of their quad here. Usually set a timer for 3 to 5 minutes. Just increasing the weight. And then just kind of sit there and relax while you're stretching. That's terminal knee extension. And then put a towel roll underneath the knee, have them push down into the towel roll. You can even note to pull their toe towards them, that really activate the quad muscle. Have them hold that for 5 seconds. Work your way to 20 to 30 reps of these. Just really push down in the towel roll or bolster there. And that'll really work on their quad strength if it's really weak. That's a real beginner. So that one's not appropriate for every patient, but if they're pretty weak, that's a good one for them to start with. Next we have the short arc, the long arc, and the prone hamstring curl. The short arc and long arc I'll show first. The long arc, we kind of note that the long arc, we're just going to do full range. So this is knee extension, hence the word long. So we just have the patient sit on the side of the table, the feet are dangling. Just have them point their toe towards them, bring it up. Really tighten that quad, you can have them hold that for 3 to 5 seconds at the top. And then relax nice and slow. And then I'll just demonstrate that again. Toe towards them, and then back down. So that's the long arc. Short arc is done supine. Grab this one here will work. So you just slide the bolster underneath the knees. Short arc. You're just going to have them again bring their toes towards them. Have them tighten that quad muscle there. Hold for 3 to 5 seconds, and then back down. So this is a good one to do before the long arc. This will be easier than the long arc quad. So again, we're working on quad strength here, quad sets, the short arc to the long arc. Tighten that muscle. Alright, and the next one would be the prone hamstring curl, which is done on their stomach. Have the patient lay flat on their stomach, which is what prone means. Legs will be straight. This is the left leg's the affected one. You just kind of have them bend it up nice and slow. Eventually gravity is going to kick in, make it easier. And nice and slow on the way back down. Again, weights will make this harder. So that's the prone hamstring curl. Next we have the heel toe raises, K16. I'll demonstrate with this step here. You just have them step with the balls of their feet up on the step, heels hanging off. You can kind of place them in front of a wall just for balance purposes if they need it. I'm just going to go up on the toes, hold for a second or two, and then back down. It's important to let their heels kind of hang off a little bit. They'll feel a little stretch with that too. So up on the toes, back down the heels. And then I'm going to head over to this wall here. I'll kind of show you the toe raises. You can lean up against the wall. Just kind of have them lean at an angle, kind of pull their toes up towards them. Same idea, I'll hold for 1 to 2 seconds. And next we have the IT band, which is this muscle through here. And you can just have a band, and you're just going to slide up and down right through there. Next is the straight leg raises, flexion, extension, abduction, and adduction. First, I'll start with flexion, straight leg raise. So one leg's bent, helps take the pressure off the back. Sometimes patients don't like to keep it straight. I like to keep the opposite one bent. Just going to pull your toe towards you, lift as high as the opposite knee. Hold for a second or so, and then nice and slow and let it back down. So that's flexion. Next, which I'm calling adduction just because it adding, so you're adding towards the body. So your legs will be moving towards your body. Just cross the unaffected leg over top. Next would be extension, lay on your stomach. Just lift and keep the legs straight. Not too much hip movement. You want to keep the hips flat on the table. And then next we have abduction, just abduction, so it's away from the body. Leg is straight. You can keep this knee slightly bent. And we don't want to go too high. Just about right in the middle of full range there. And that's abduction. Next, I threw on KX, which is just the bike. So you can have them do like a 5-minute bike warm up for the exercises. And that concludes phase 1 of the knee